Today I will just explain to you what we do. We do bite balancing, not alignment. Sometimes it is done after alignment and sometimes it is done before alignment. When the bite is imbalanced, why we do? Because when the bite is imbalanced, the teeth wear and break faster. Normal dentition, normal teeth are canine guided, means canines touch like this when you use your jaw on the side movement. This is the canine. This canine touches, rest of them don't touch. This side and this side, both sides they don't touch. So canine guided occlusion. On the left side when we move, on the left side also same, the posterior teeth do not touch. When you move the teeth in the front, they don't touch. Only front teeth touch and posterior teeth don't touch. There is a space here. So whenever there is a canine tip loss, when the canines wear off, multiple teeth touch in unequal ratio, in proportion, and there is known as hit and slide mechanism starts. One tooth hits first like this, or one tooth will hit and one tooth will be hitting first and like this one tooth will hit and then it will snap to the other one. So one will wear, one will break. This hit and slide mechanism keeps increasing with life, and the teeth keep wearing and breaking, and multiple problems of TMD. Some people have extra oral symptoms of TMD. It's like some people will have head and temple region. They will have headache, early morning headache. Some people have migraine. Some people will have vertigo or dizziness. Some people have ear symptoms like ear pain, blocked ear, tinnitus, ringing ear, or passing of air in through the ear, or some ringing sensation or some tingling sensation of ear. So, and some people have TM joint, which is right in front of ear, like popping sound or clicking sounds, or some people have locked jaw. So bite imbalance can cause multiple kind of a problem. Some people have yawning pain, discomfort while opening and closing. They feel pain in the ear or in the muscles. Some people have joint pain while chewing. Some people have neck stiffness. Some people have difficulty opening and closing. Some people will have a locked jaw, and some people have a combination of all these, or some people have one or odd one. These are extra oral problems associated with bite imbalance, which is known as TMD, temporomandibular disorder, and TMJ points. And some people will have only intraoral, like teeth do not feel meeting in comfortable position. Some people will grind their teeth at night like this, night grinding. Some people will clench their teeth in the morning, like they feel like clenching. So some people feel like eating from one side. Some people don't feel that the bite do not take pressure on one side, right or left side, they eat from one side. So some people have front upper teeth edges chipping, or a lower ones wearing or chipping. Some maximum people have canine tips loss. Canine tip means the corner lower tooth or the upper corner tooth will be worn like this. No tip. This is a tip, canine tip, lower canine. There is no tip here. This is a tip. So canine tip wear. So there is no canine tip. Some people have thinning of teeth. Then some people will feel that multiple teeth chip frequently. They go for root canal or filling, and the filling keeps coming out. Some people feel that the teeth are drifting or sliding and opening up the spaces. So there is a small space coming up in the front teeth. Some people have recurrent gum swelling when the pressure is unequal. Some people will have recession. So in which some people will feel that their teeth are more visible. So all teeth have become loose. So, and some people will frequently go into root canal because one tooth breaks, then another go into root canal, the second one breaks, they go for root canal. And sometimes some people will have food getting stuck in the joints. So, and those who have already got root canal done or crown done or bridge placed, they keep coming out. The bridge comes out, the crown comes out, the crown becomes loose, the crown breaks, the ceramic breaks, the bridge keeps coming out. So that is all because of bite imbalance. I'm not talking about alignment. Alignment is different. So in case you have any of these problems or a combination of these, some people may be having only intraoral, some people have extraoral, and some people will have a combination of these, and some people live with this. They go to doctors, ENT, neurologist, general physician, but they have not found the relief. Then they can get their bite imbalance check by simply getting a 3D scan done at any center in the world, and the scan can be seen. So first assessment is by doing a 3D dental scan, which is non-radiation scan. So normally what happens is a jaw is canine guided, and human dentition do not have balanced occlusion. That is imbalanced occlusion that can be balanced either before the teeth wear off or before they come. So non-worn state, or partially worn state, or fully worn state it can be. If it is non-worn state, then we can do alignment and balancing. Balancing is must. Only simply alignment by liner do not balance it. Some people have partially worn teeth. Some teeth will be worn by age of 25 to 35. Some teeth will not be worn. So we do alignment plus balancing, not simply alignment. So alignment and balancing is must. Why I say balancing is must means we have to distribute the load, and whichever tooth is worn, it has to be restored. Like in this case, it has to be restored. We cannot align these teeth. The worn teeth cannot be aligned. They have to be aligned and restored. Simple alignment will further imbalance the occlusion and may cause TMT, stimulate some pain. So, and some people do not come to know anything, and the teeth keep wearing because of more. Once the hit and slide occurs, the teeth keep on wearing, and they become sensitive. The enamel goes off. The teeth become flat like this on top. The cusp tips become flat. They become flat. Some people will have only front teeth. Only the front teeth wears off. This is known as hit, slide and wear. This is hit, slide and wear, wherein only front teeth are flat, rest of the teeth are okay. Front ones, lower ones are flat, upper ones are also flat. Can you see this? The behind is okay. So some are hit, slide, wear. Some will have hit, slide, collapse. Collapse means hit, slide and collapse means if it is deep bite, it will just keep on going inside and you don't see the lower front teeth. So that is known as deep bite, but that goes into hit, slide, collapse. One tooth breaks, second breaks, and you find some indentation on the upper teeth and edges blocking of the lower teeth. Some people will have hit, slide, push, wherein when upper teeth will open up, the front teeth will open, and they will find that the teeth are opening up, the spaces are coming in between the teeth like this, the spaces they become when they hit from the lower side, they push and they become loose, and then spaces develop on the side of teeth. So that is hit, slide, push, and some people will have a combination thereof. So we have to diagnose the cases properly, and then we decide that it has to be balanced. It can be balanced at any age. Either should be ideally balanced between 18 to 25, but it can be balanced at any age. Before the teeth wear off is best. Now what we do in balancing is why we do is to prevent the teeth from further breakage and wear and frequent problems associated with dental teeth. And some people will, since they suffer with TMD, so that automatically reduces the TMD symptoms. Now how we do is we take the impression. First we take the upper lower impression, and how we do it is we take the upper lower impression, then we check the scan, which teeth are worn, whichever is then in 3D scan we check all the teeth status. Occlusion status has to be seen from all the angles, from inside, outside, deep bite, class 1, class 2, multiple teeth are seen. From multiple angles we see. Now if the teeth, mostly we see the teeth condition, whether the lower incisors, lower teeth are touching the upper palate or not, and the canine tips are worn or not. If the canine tips are worn, this is the earliest indication of imbalance. The canine tip has to be like a canine tip. If the tip is missing like this, if the tip is missing means the balance is occurring and it is increasing. So canine tips we check earliest. Like in this case, we see the canine tip was missing here. Canine tip was missing here. There is no canine tip here. So canine tip missing means it has gone to imbalance. The person will definitely go into hit and slide. The teeth jaw will go into hit and slide. We have to balance the occlusion. So normally in dentistry, what happens is we go to dentist with one teeth breaks, we go for root canal or crown. The other one breaks or wears, we go for another filling or crown. That keeps happening. The frequency of trouble keeps increasing, and we keep on getting a treatment, but at that height, because the bone teeth, the height must have been initially this much, but once they wear, the height is this much. So we treat the teeth. We are not treating the occlusion, bite. If we treat the bite and we restore the bite at this level, the further wear and tear will be reduced. So what we do, we check the bite. Once we check the 3D scan, which is a non-radiation scan. Once it is assessed, the teeth are damaged or okay, then we decide further that if it is in a bone state or whatever symptoms have been mentioned, if they are suffering with that, then we go for full bite analysis. Once 3D scan is assessed, check from all the angles, then we go to the next step, which is, if required, goes to bite analysis. I'll show you how. So in bite, then we see the OPG to check the bone condition. To check the bone condition. First we check the bone condition like this. If you see, we see the bone. Okay. Then we see the bone. We see the OPG, whether bone loss is there or not. I'll show you 1 second, please. 1 second. Yeah. Okay. So we see overall inside. 3D scan is to check outside. OPG is to check inside. We see the bone. This is the bone. This is the tooth, which is root canal. Which is there is any other abnormality. We see the joint of TM joint, but that is normal. So we broadly check everything with OPG scan. Is there any major problem or not, and whether the bone condition is okay. Then we go further. We do, if required, then we do phase bow record. Which is a phase bow record means we replicate the teeth and the jaws on the articulator. We replicate all the movements of teeth on the articulator. This is a diagnostic thing. We just put it outside to see the orientation of jaws, and we fix them on an articulator and check all the movements, because every movement is not possible in the mouth. So we check it on the articulator. That is known as full bite analysis. In bite analysis, we do phase bow and check from inside, outside movement, laterosive movement, protrusive movement, and sideways movement. We check all the movements, and then we go next. We do the centric bite. We put it in the articulator, orient it the way it is in the mouth, which are semi-adjustable, fully adjustable. Then check for all the hit and slide points. If you see in this we check the hit and slide points. This must be the first point of this. We check in all the movements, and I'll show you. Yes. Now this must be the initial culprit. First point of contact we check, where it hits first and rest of them don't hit, they hit later. That is the place where that is the point of hit and slide. So we check it in articulator, counter check in the mouth, and then we proceed further. All excursive movements are checked on the articulator. Then whichever tooth is gone, we add them without reducing the teeth. Natural teeth we don't grind, we don't do root canal. We just add them, check the canine guidance, whether this is interfering, this is interfering. So we reduce the interferences. So we create a canine guided occlusion, which is free of lateral interference. And we check all the movements in the front side, on the left side, whichever is worn. Then considering the occlusal parameters, we rebuild them without reducing. If it is, sometimes it's composite, sometimes it's ceramic, sometimes it's a combination, sometimes it's alignment. So it's a complex treatment, which, depending upon the category of patient, which is symptomatic, non-symptomatic, worn teeth, partially worn teeth, fully worn teeth, and a combination. Sometimes it's a very complex one, but then we decide for the treatment, which patient requires which treatment. Once it is, then digitally we check all the movements, whether they are interfering while moving, and where we need to add. We decide. Once we decide, then we go with further treatment. This is done digitally. We add them and create. So we don't require to do root canal, we don't require to do crown for all the teeth. You can just add on composite and distribute the forces. The slide is reduced. So we need to reduce the slide. We don't want this to just slide like this, because the slide like this, it will wear off and wear. So we just add on wherever necessary. Like in this case, we have not added on there. We just added on in between. This is a detailed abstract of detail. You can just go through the video. You will find out that what I have written is the treatment for this patient in this condition. But there are multiple conditions, multiple factors wherein treatment is the different tools, but we have to know which tool to be used where. So I'm just telling. Now the next stage comes wherein we have, in this case, then we do bite balancing. In this case, see, if you see, we, after checking the bite, we realize that there is a space here. That means this much of space has to be closed. Now once we see that these teeth are worn, sometimes this is worn, so we may have to add here, we may have to add here, we may have to add here. That is depending upon the status of teeth. But once we have seen that this much of imbalance is there, we have to correct this much of imbalance, otherwise the slide will be more. Different people will have different slides. So we, by bite analysis, we take out the discrepancy, deviation, and between the current bite and the corrected bite. And once it is finalized that this is the bite or this is the height wherein we have to work, then complete digital system, we have to work on this height only. We can, if the patient closes at this height somewhere. This height may be different than this height. So right now the treatment in the world is, everyone does is, we are treating the teeth at this height. So the breakage continues. But if we correct the height, the breakage will be reduced. Because so we have to open the bite in case required. 1 millimeter, 0.5 millimeter, 1 micron, we don't know. That everything varies. So then we decide what treatment has to be done for which patient, which tooth. Every tooth will require different treatment. Some may be requiring only alignment, some may be only composite, some will only a part of it. In this case, we just put an add-on a canine tip. Here canine tip. So canine guide will do this. We have to ultimately create a canine guided lateral interference free occlusion. So then next step is we will add on wherever required digitally. Once it is added on digitally, then we check in the mouth whether, like in this case, we need to just add this much without grinding, without cutting the tooth, without doing root canal. We can just add on. So in this case, we just decided to add on in these teeth, whereas this white, we did not touch the front teeth. In the behind, if you see, we will just add this much to balance the occlusion. So we will just add this much to balance the occlusion. Just added this much to balance the occlusion. Here and in upper, wherever there is white portion means we have added. A balanced occlusion, there will be less hit slide, there will be less breakage, there will be less wear and tear. It's just like putting a Teflon coating or putting a toughened glass on a on a phone, so that main glass doesn't break. So we add on a layer of filling or a ceramic on a tooth which is worn to balance the occlusion. Which is worn. If it is non-worn, we can just line them. But balancing is to equilibrate. Sometimes we require equilibration, which is to distribute the forces, because the teeth have to have a perfect point of contact. Occlusal lock has to be there. They shouldn't be sliding like this. If I add this much, it will not slide. If I remove this much, it will slide. So in this case, we added this much to balance. Then we decide which tooth requires what treatment: composite, ceramic, filling, ceramic, combination bridge, implant, whichever required to balance the occlusion, to add on or reduce by addition or subtraction. Decide how many teeth involved. Some people have 23 teeth, some people have 5 teeth. So everything will be decided after doing a bite analysis. Like in this case, we just added. So we decided to add on, checking all the movements. This is a simulation scan of a patient, wherein we check by just software whether how much slide is showing. This is an approximation, it is not confirmation. It can be this much, it can be this much, it can be this much, but we take it out with a centric bite and a phase go record, and we decide that we have to create the occlusion here, not here, because this is a simulation. So in this case, one tooth is here, see. Show you more. Show you more. Okay, now this is the status where we have once this is the original, this is the post. So wherever we require, the forces are distributed. So we have to give static contacts, dynamic contacts, and occlusion stress has to be distributed. Every tooth will have one point of static contact on each tooth, and then it has to be equilibrated over a period of time to balance the occlusion. So this is the original, this is the weak, this is the corrected bite. We have corrected the bite in this. Now this is the final. So if you see, we have just added on. Okay, I'll just show you once again. Okay, I'll show you here. In this we have just if you see this here, we have just added on composite. No grinding of teeth. No grinding of teeth done. Only composite. And each tooth is flossed. We can floss it, polished, without grinding into it, without doing a root canal. Now this is, if you see, this is post-op right MI. This is finished, completed. Then we check in. Then that is a main point. Okay, in latrusive movement, there should be space here. There should be space here. There should be space here. It's touching here. One point is touching. It shouldn't touch. So this is the ideal occlusion. This is the current bite where we are working on. We should be working on this and make the occlusion like this. Lateral movement, there should be space. It is only canine guided. Only canine guided. There should be space. When patient reported, it was like this. It was touching. It was touching. That's why they were breaking. So this is external photographs. You can miss them. This is okay. Now this is the. I think this is the final one. Complete disc. Okay, this is the final maybe. What we did. Yes. This is the current bite, but we have to balance it. I'll show you how balance. Okay. In my other video, you can see the whole flow. This is just explanatory video. Might not be very clear. Would have to place the implant because they were breaking completely. Then, so start to finish, I'll show you. This is canine guidance. We have to create the canine guidance. Canine guidance means, I have already explained, there should be spaces between post teeth. They shouldn't be touching while moving. Now, okay, this is the full thing, start to end. I'll show you. Okay, if you see, I have added on here. This was the original one, and we have added on this. Whatever digitally was there, it was done on the in the patient's mouth, and we have added on. This was the original one, and we have added on here. Some composite, some ceramic combination. Sometimes only composite on all the teeth. Sometimes only ceramic in all the teeth. Sometimes combination of ceramic and composite. That depends upon case. Every case is different. Ultimate aim is canine guided occlusion, and curve of SP has to be maintained. Occlusal dynamics to be considered in all the patients. So we give only canine guided, interference free, occlusal locked occlusion, and we reduce the item slide so that wear and tear is less and teeth are saved for life. So our aim is to save the teeth for life. Implants, in case necessary, one can go for implants at any time. So in this scenario, in this case, we added on. Patient wanted to save the teeth, did not want to go for all implants. So whatever tooth could not be saved, we sacrificed it, and rest of them were only added on. See, in this case, we have added on. In my other link video, you will be able to see in detail. This is not a clear. Where is that on video? This we have done. See, original is this. Okay. This is finished. Detailed steps can be explained later in some other video.